Welcome to the Massage Tools Podcast, your home for cool interviews and reviews. Irene Diamond, thank you so much for joining us today. I'm going to hit you with my quick 3 questions. First, how long have you been in the industry?
Oh gosh, 31 years.
Okay. Second one, where did you go to school?
San Francisco School of Massage. I'm in San Francisco, and I chose it because it was the shortest program. I needed to know what to do with my hands and get me out there in the world.
Okay, great. And then the one that's not always fast, but it's always an important question. What got you into massage therapy?
Yeah, it's not a short story here. So I'll consolidate it down because it's sort of like multi-pronged. When I was 15 years old, I was an acrobat, and I would do gymnastics, and I would do the things that people do now, the cheerleaders, where they're standing on people's shoulders and doing pyramids and lifts and all that good stuff. And I was working with a partner who we were practicing right before this competition. It was an acro sport competition. And I ended up our balance was off. I was supposed to go and do this forward somersault, and he was supposed to catch me. And basically I ended up doing a dive from the height of his shoulders down I fell into the mat. Luckily I was on mats. Put my arms out to stop myself, my elbows bent, and I ended up on my head.
Oof.
Laid there, unable to move.
Oh boy.
So what happened was I had a compression fracture where I actually broke C5 and 6. I was completely paralyzed from the neck down. I could talk, I could breathe, I could move my face, but I couldn't move my arms or my legs. But luckily, the person whose shoulders I was on was an anesthesiologist and immediately suspected a neck injury. Now, this was when I was 15 years old. So a long time ago, healthcare, emergency medicine, completely different. Now they have these backboards they scoop you up on, they put you in neck brace. At that time, they had to, literally, the ambulance driver held my head as we drove to the hospital. So long and the short of it is I was in the hospital for 2 months, ended up with spinal surgery. They fused a bone from my pelvis into my neck, have a wire or 2 in there, and basically sent me on my way. I was young. They said, see you later, and left me to figure it out on my own. I had a Philadelphia collar, so I walked around like this. I couldn't move my neck for a few months, and I was having to rehab myself, but I was in chronic neck pain. I would have these migraines that just wouldn't stop. And my mom said, why don't we try a massage therapist? See if that can help your neck. Bingo. So the massage therapist came to our house because I couldn't really be driven around at the time. And I instinctively said, just push right here and hold that spot. Now, I had no idea what that was at the time, but now I know it's like the attachment of, the second cervical vertebra. And so I started getting relief from this massage therapist, sort of following my guidance. I was doing the moving, he was doing the holding. I didn't know what that was all about, but I just knew it was working. He then took what he was doing with me, trying it with his other clients and getting really good results. So fast forward, after high school, went to college, got my degree in rehab therapy and movement therapy. Had no idea, no memory really of the manual piece, but knew that I wanted to help people who had pain and dysfunction. Thought I wanted to use movement since I was a dancer and a gymnast. Thought I wanted to use that as a way to rehab people. So I got my degree, decided that I wanted to provide fitness and sports on cruise ships, did that for a couple of years, and then wanted to provide a more comprehensive fitness program on cruise ships. Moved to San Francisco and had no money. This is way before, GoFundMe's and startups and all that. And so I had to figure out how to make some money to fund this travel company where I was going to be providing fitness cruises on international ships. A friend of mine said, why don't you go to massage school? And I would unofficially just rub people and do stuff when they had pain, like most of us, right? And he said, you're really good with your hands. Why don't you just go to school and learn what to do? That way you can see a client or two, make $100, and then have the whole rest of the time to invest in your program or in your cruise program. So I did. And I went to school, not thinking I was really going to be a therapist, but thinking that was going to just help me make some money so I could do the travel piece. But I loved it. I was able to get really good results with clients. They liked it. They didn't like when I would disappear and go off on these cruises. So as my clinical practice started to develop, my cruise practice was business was growing. And I was in this conflict of, well, how do I see clients when I'm traveling all the time? So I had to start hiring therapists to work for me when I was out on the ocean. And that's how it happened. So my intent was never to be a manual therapist, although it segued into that. And then I started integrating the piece about pressing here and shaking your head, or holding here and having the client be active. So that became a sort of another part of my another business, another arm to my business, which is now the Diamond method of manual and movement therapy that I teach to therapists around the world. And it incorporates clients being active. They're active participants, as opposed to typical massage, as you know, where clients lay on the table and they're passive, or typical physical therapy or chiropractic or acupuncture, where the patient is passive. With AMT, the patient is active, so the results are way faster, and it's easier on us. You know, I've been doing this now for over 30 years. After a while, your body gets kind of tired, so it's nice to let the client do the work, and to have us use our brains and our critical thinking and clinical thinking to be able to structure the session, but not be doing the physical piece. Okay. That's how I got into it, based on a broken neck.
Awesome. Yeah, I mean, it's a fantastic story. You know, I read through your bio and a little bit on your website, because our mutual friend Tom Benson's like, you got to have Irene on. I'm like, okay, I haven't met her. I don't, everybody I've had on so far, with the exception of one, I know personally. So these are people I like send them a text message or call and be like, hey, will you be on the podcast? But you commented on his post about the podcast, and that's what kicked off our discussion today. But yeah, it's a very interesting story, and I love to hear it. And I also love when you have a practitioner that's been in, really, I feel anything over 10 years, but when you get that 30 plus mark with like, what are you doing with biomechanics, or what are you doing to maintain longevity in the system? Would you mind sharing any advice you have for younger practitioners or people newer in the field in regards to some of the biomechanics or anything that helps with longevity?
Well, longevity comes from it's a two-pronged approach. One is physical ability to keep doing the work, which you said. The second is longevity in the business world, just staying in business. How do you keep a business running? Especially when there's these, roller coasters of closing because of COVID or economic shifts, things like that. You need to have a way to keep the business running. So biomechanics, sure, you need to, again, I was a dancer. Movement was my focus. So I was always aware of forces. Like a simple phrase that I always teach when I'm teaching the clinical piece is to face your force. So if you're pushing, you face it, you push directly forward. You're not pushing off to the side. And so if you find yourself in some contorted position over a client, check yourself and go, wait a minute, let me get upright and let me use my body weight to lean in, or use my elbows to lean in. Making sure the table height is right. That's a key piece. Making sure that the client is adjusting. Like when I teach, one of the things I always have the therapist do is the client might lay on the table and they may be in the middle of the table, but if you need them to scooch over, don't hesitate to ask them to scooch over to get closer to you. But sometimes we feel, at least I know at the beginning, therapists feel like they can't really ask too much of the client because the client's there to relax. Yes, but you can say, can you move to the right a little bit so I can get into your leg easier? That way you're not hurting yourself reaching over, especially for shorter practitioners. It's harder to work on bigger bodies. They have to be aware of their ergonomics. That's a big piece. And then again, just understanding how to keep a successful practice going.
Thank you for joining us, folks. The mission of Massage Tools Podcast is to inspire. So help us inspire you. Ask questions, leave suggestions in the comments section. Give us a like if you enjoyed the video. And if you want to see more content, please click that subscribe button, turn on your notifications, and hey, check out these links for other videos here.